نبدأ بسم الله الرحمن الرحيم. Welcome to this weekly scientific meeting of Agouza Vascular Unit. The talk today, how to pass MRCS Part B OSCE exam and MD examination as well. I have been examining in the Royal College of Surgeons of England in the past 10 years, and I'm also a member in examination of many universities in Cairo. The examination contains a certain style rather than just studying about the subject. So we will speak today how to examine thyroid gland. A lot of the candidates fail in the thyroid gland station because they have not developed a system. Because they haven't developed a system of doing an exam, they will find that examination becomes very, very difficult for them. The examination, I've tried to summarize my experience about the exam. It is not just being good in the knowledge, but you must have a good exam attitude, and you must have certain skills to pass the exam. So let me have my first rule. Wiper, then EPA, and finally water with E-boxes. سؤال للدكتور كريم, have you heard this before? You can unmute yourself, Dr. Karim شعراوي.
ايوه بيه، مع حضرتك يا بيه.
Okay.
لا طبعا الوايبر دي نفسها ما سمعتهاش، بس انا شفتها بره طبعا، شفتها كلينيكال يعني.
Okay. Wiper, then EPA, finally water with E-boxes. I will explain what this means because it will help you to pass the exam. When you are an examining, you are in what is called the OSCE station, which have a certain system. And the big defect in our Egyptian colleague, they didn't get training in OSCE in medical school. I examined both in London and in Egypt, and there is a big difference. Because the exam in Egypt, you don't get OSCE examination from year 1 medical school, while in London, you get it from year 1. So wiper is what you do before examining the patient. Wash your hand, W. I, introduce yourself and get informed consent. P, ask for pain. Are you in pain? If the patient is in pain, you just change the whole routine of the exam to see what is the cause of pain and you treat it. So you must tell the patient, are you in pain? And if you feel any pain at any stage of the exam, please let me know. A lot of doctors from Egypt, when they examine thyroid, they press in the neck and the patient say, ouch. If the patient say, ouch, you fail the exam. That's it. There is no second chance in this station. E, expose the patient. A lot of times we give you patient with a tight shirt or tight collar. I want to know if you are able to do a good exposure or not. And R, reposition the patient. Let him in the position best for the exam. And this is what is meant by wiper. So remember, before you examine, wiper. During the exam, EPA. After the exam, water. And when you discuss a case, E-boxes. So let us go over the EPA. What EPA means? EPA, during the exam, at any organ, you must do inspection, palpation, percussion, auscultation. A lot of doctors forget to auscultate the thyroid for Browy. What water mean? And remember, W is capital, A small, TER is capital. And this is what you do after the exam. When you finish the exam, before leaving the OSCE station, you must wash your hand. And this is W. And you must thank the patient. And this is T. and you must ensure comfort. And this is E. Make sure the patient is comfort. This is well appreciated and you get more grade. Are you comfortable? Do you want me to let you a hand to go to the bed other than a chair? This is very important. And finally, report your finding. Every OSCE station is 9 minutes. You have 6 minutes to examine the patient, and I will show you a video which is, in my view, is an ideal, and then 3 minutes to report your finding. And you must get training how to train yourself to do finding in a regular manner. What e-boxes mean? When I discuss a case with you, you list the following in order to discuss the case. What is e-boxes? E-examination, you do it and you say the summary of the exam. B is blood test. O is orifices, which mean swab analysis, urine analysis, sputum analysis, stool analysis. X, discuss an X-ray of this organ, abdominal X-ray, chest X-ray, erect, supine. ECG finding, also important to discuss if the patient have an ischemic heart or not. And finally, a special test. So remember, wiper, EPA, water, then e-boxes. This is very important system, and a lot of doctors from UK know it. When you are examining a thyroid, you must know steps. A lot of Egyptian doctor will stand in front of the patient, doesn't know what to do, and doesn't know what to begin with, and what is the end with. You must do these following 7 steps in that exactly same order. Number 1, introduce yourself. Wash your hand. Brief explanation to the patient what you are going to do. A lot of Egyptian doctor, when I tell him examine this thyroid case, he goes straight to exam. No washing, no asking for permission. He have lost 4 degrees by just doing that. Secondly, you start by general inspection, and I will tell you a trick. A lot of doctors do the exam without speaking. So if you do general inspection, which is looking at the patient, and you didn't say anything, I don't know what did you grab. But if you say patient is lying comfortable, it doesn't look to have alopecia, doesn't have look to be sweaty or in temperature, doesn't look to be in pain. Now you translate what is in your mind to the examiner. And this is important because it will give you grades. But if you look for inspection, don't say anything, you probably will not get grades. Now, number 3 and 4, examine hands, then eyes. In the hands, you need to do 4 things. Nail beds and fingers, palmar erythema, a check for fine tremors by putting paper on both hands, and radial pulse. You must memorize them by heart. Eye, you do 4 things. You mention that there is exophthalmos or not, and you show me how you examine for exophthalmos. You check eye movement, and you report lid lag and lid retraction and the convergence. And you must show me how you do it. 5 and 6. Number 5, face and the neck. And this is very important because this will contain most of your exam. And you report as you go along. Initial inspection, palpation of thyroid gland, palpation of lymph node, and you show me which lymph node you are palpating at this stage. Important to mention that. Don't be silent. Tracheal deviation, and tell me if you felt tracheal deviation or not. Auscultation of the gland, a lot of people forget it, with retrosternal percussion. Number 6, examining of the legs for mixed edema. This is important and a lot of people miss it. Test for patellar reflex, for hyperreflexia and thyrotoxicosis. And you also do sit and stand testing. Now, finally, final 7, completion of the exam. You must thank the patient. This is important. And to complete the exam, you inspect for gynecomastia and perform cardiovascular examination, blood pressure. Usually, there is no time to do these 2 things. But you tell the examiner, if I have time, I would have examined his cardiovascular system and blood pressure, because this will give you a lot of information about the thyroid gland. So it is 7 steps. You must remember them by heart. Examining thyroid from 1 to 7. Don't make one step before the other. Now, another thing that I would like you to know before the exam, لما تعرفوا لعيبة الكورة بيلعبوا 4-2-4 you need to know 4-2-4 EH. I will ask again Dr. Karim, if you unmute yourself, have you heard 4-2-4 EH in thyroid exam before?
لا الحقيقة لا يا بيه.
Okay. When you're examining thyroid, there are two systems, system to examine from front, system to examine from the back. But the best system is you do 4 things from front, 2 things from the back, 4 things from front, and you do EH. Okay? This is how to know where you stand during thyroid exam. Now, the 4 things in front, I've called them F1, 2, 3, 4. F1, move upward with deglutition. Ask the patient to have a sip of water, and we'll always give you a sip of water, we'll give you gloves, and we'll give you a sterile to sterile your hand. Number 2, put your tongue out. Can you put your tongue out to see if it moves up or not, if there is any cyst like thyroglossal cyst? Number 3, scar. If patient have previous thyroidectomy or hemothyroidectomy, you must report it, dilated neck veins. And Burton signs. You must know what is Burton sign. This is a sign when you have a huge thyroid enlargement, incursion on the venous return in the thyroid, in the thoracic inlet syndrome, and when you ask the patient to raise his hand, he gets congestion in his face. This is Burton sign. So this is what you do from front of the patient. Then you go to the back and you do 2 things in the back, B1 and B2. B1, palpate from behind, consistency and nodularity. And always speak while you are doing the exam. Don't just examine and don't say anything. If you palpate his thyroid, didn't tell me anything, I don't know if you done the exam right or not. And cervical lymphadenopathy, better to be examined from the back. Then you do 4 again from front, which F1 to F4. From front again, you do tracheal deviation, retrosternal extension, displace the carotid artery, and Brewi. So you always go to the exam with the auscultation, auscultation tube around your neck. If not, we supply it during the exam. You'll find the stethoscope, the sphygmomanometer, a cup of water, a tongue depressor, and so on. Now E and H, E for exophthalmos. And very important to show me how you examine for eye sign in thyroid. And H for sweaty hand, tachycardia, and tremors. And you must mention if the patient have this. So remember, we said 4-2-4 EH. This is very important. My advice to you, do thyroid exam 100 times. If you do it 100 times, it becomes stored in your memory. And the next time I will show you some memory tricks to save information quickly so you don't forget it during the exam. What I call memory tricks for the exam. So 4-2-4 EH, remember them, and this lecture will be on YouTube after half an hour, so you can write them down. Now you need to know the surface anatomy of the thyroid gland. You must know very much each structure, and when you do palpation, you mention thyroid cartilage looks normal, cricoid cartilage in place looks normal, thyroid gland doesn't look to be enlarged or enlarged, and so on. So you must know the anatomy. Now, these are the changes in MRCS exam that is happened after COVID-19, and I will discuss it over the next. Also, in the MD exam, we haven't changed much. Still, MD exam in Shams University and Cairo University and the Ghazi University and Bani Suef University is the same. You get an examination of thyroid case, and you are examined and being asked a question, which haven't changed much after COVID. But the MRCS have changed dramatically. From having 17 OSCE stations, now you have 13 OSCE stations. And there is a lot of modification we do in order not to bring any patients and not to bring any actors. And hopefully the exam in Cairo will come soon. So I will show you this video which to me is an ideal video that shows how you examine thyroid. The video length is around 7 minutes. And this is exactly the time that you will have to examine thyroid gland, which is 6 minutes. Notice the video carefully. This is the best video over the internet.
Hello there, my name's Andrew. I'm one of the final year medical students. Could I confirm your name and age, please? Hi, I'm Simon, and I'm 24 years old. Nice to meet you, Simon. Today I've been asked to examine the thyroid gland in your neck. Would that be okay? That's fine. This will just involve me generally inspecting, and I'll move in closer to the neck to have a closer look, and then have a feel of the neck as well. Is that all right? Sure. That's great. Are you comfortable where you are? Yeah. Fantastic. We'll start.
In inspection, you speak, you tell me patient doesn't look to be agitated, is not anxious, doesn't look to be in pain.
Simon, if you could just bring your arms out in front of you like this and splay your fingers.
You mentioned no clubbing, no obvious tremors. There is no tremors in this case.
If you could turn your hands over for me.
You mentioned if the skin is dry or sweaty, if there is palmar erythema or not, and you show me how you feel for sweating and temperature. When you feel the pulse, you report on the pulse. Is it steady? Is it hyperkinetic? And you report on the face. Face have a dry skin, sweating, doesn't have a sweating, doesn't have an eye sign. What you immediately see, you report it.
I'm now going to look more closely at your eyes. If you could just pick a point on the wall behind me.
Lid retraction and the eye signs, extremely important. This is how to examine for exophthalmos from the side.
And I'll now look from behind. You can just look slightly up for me, Simon. We're just going to do some movements of your eye now, Simon. So if you could just follow my finger.
This is edge test for eye movement, extremely important. Look at the finger, how he moves in an edge direction.
That's great. Again, if you could keep your head still and follow my finger for me. Thank you. I'm just going to more closely inspect your neck now. You just stay as you are.
You show me that you are doing an inspection to the patient. There is skin changes or not, obvious scars, enlarged thyroid gland. So you mention this while you are doing it and do exactly the same steps that is here.
If you could just take a sip of this water and hold it in your mouth. And swallow.
Movement with deglutition up and down,
Fantastic.
very important.
Stick your tongue out now.
Thyroglossal cyst, protrude your tongue.
And I'm just going to feel your neck as well.
Now we've done 4, 2 from behind, then 4 from front. 4, 2, 4. Palpate and report your finding. Don't be silent and report them in an order. He's feeling thyroid gland.
You could just stick your tongue out for me, Simon.
He's confirming
Great. And if you could just take a sip of
the
the
swelling moves up and down or not.
And swallow. I'm just going to feel the glands in your neck.
He's feeling for the draining glands, and you mentioned, I'm feeling supraclavicular nodes, cervical posterior group nodes, retroauricular nodes, and you mentioned every node group by name.
I'm now going to feel your windpipe. It might be a little bit uncomfortable.
He's feeling the trachea.
I'm now going to tap on your chest.
And you can do these 2 steps from front for retrosternal goiter. Auscultation, as we said,
Just take a
EPA.
deep breath and hold your breath there. And breathe normally.
And any carotid bruit.
Simon, I'd just like to finish with some special tests. So we're going to start with the reflexes in your arms. If you could just relax your arms on your lap like this with your palms facing to the ceiling.
For hyperthyroidism, you need to check reflexes if there is hyperreflexia, and you show me how to do elbow reflex, how to do triceps reflex, how to do wrist reflexes.
I'd just like to look at your shins, if you wouldn't mind rolling your trousers up for me. Sure.
Pretibial myxedema is also important. You need to examine the legs, and this is how myxedema looks like.
Finally, if you could stand up, but first I'd like you to cross your arms for me.
It's checking for myopathy
And relax.
with Graves' disease.
This completes the examination. Thank you very much.
And this is the completion of the exam, which is exactly 6 minutes and 28 seconds. So I will open to discussion because I like it to be interactive. So if we start by Dr. Karim, you can unmute. And what did you find new in this lecture and video?
والله يا بيه أنا عندي ملاحظة صغيرة. I think this candidate, if he will be examined by you, sir, in the exam, he will fail. 2 main things.
Yes.
The first thing is the inappropriate clothing. He has to wear at least يعني scrubs or a palto or anything that indicates that he's a doctor.
This is very good point that you mentioned. There is a regulation in the Royal College for the costume you go to the exam. You are not allowed to wear a white coat. If you come with a white coat, you fail. The exam is exactly when you work in London. Is you tight your sleeve up to the elbow, so the hand from your hand to the elbow is exposed, and you don't wear any watches. All the watches, all mobile are taken before the exam. And if you have any tie, you untug your tie. Untug your tie يعني تحط الجرافطة بين الزراير بتاعت القميص عشان ما تلخمكش في الاكزامينيشن. He is exactly what is called dress code for candidate. In the dress code for female, you are not allowed for any نقاب. ما ينفعش واحدة تخش الامتحان بنقاب. ولو واحد دخل غير اللبس ده he will not allow it to go in. مش هيقدر يخش المرحله دي. فدي كويس انك اشرت للنقطه دي دكتور كريم. وخش على الرويال كوليدج اكتب دريس كود فور ذا MRCS اكزام.
معلش يا بيه انا اصلي ما دخلش الاكزام الرويال كوليدج فطبعا مش عارف التفاصيل دي. انا بتكلم كلام عام كانه اكزامينيشن في اي حته بره يعني.
قوي لا we have a rule and this is the rule. I remember when my son went to clinical attachment in UK, the first thing the head nurse told him, no watch, your sleeves up to the elbow, no watches, and your tie is tucked in. This is the dress code for doctors, and this is how doctors should behave. You can read a lot of paper about the white coat in cross infection. كمية الانفكشن اللي بتحصل من لبس البلطو الابيض especially in COVID era، وعشان كده هو ممنوع في معظم مستشفيات انجلترا. Any other comment كريم؟
الكومنت الثاني اللي خدت بالي منه the pair، انا ما اعرفش طبعا في الرويال كوليدج ايه النظام، بس he's examining the patient without wearing gloves. is that يمكن هناك ده طبيعي ولا ايه مش عارف.
No. This is pre-COVID video. This video was 5 years before. Where you are allowed to examine without gloves before COVID. After COVID, we give you gloves and we give you mask. And we are not allowed to bring you a patient. وبالتالي ده النظام الامتحان في MD في الدكتوراه، لكنه بالنسبه لل MRCS exam it has changed quite a lot. لكن انا حبيت اقول لك السيستم يعني.
الحمد لله احنا كده في مصر بقى سابقين. لا اي عيال الحمد لله لابسين الجلافز الحمد لله.
لا مفيش مشكله، بس هو
احنا سبقنا في حاجه اهو.
لا انا امتحنت MRCS 10 سنين يعني. لا you do examination with your hand و you show me how you do percussion, how you do palpation, how you test for temperature. You wouldn't test the temperature if you are wearing gloves. لكن البوست كوفيد ليها سيناريو تاني مختلف.
الملاحظه الثالثه يا بيه،
اتفضل.
في ملاحظه ثالثه في ال في الاكزامينشن بتاع التراكيال ديفيشن. هو الحقيقه استخدمه بنفس الايد. انا اللي اعرفه ان لازم تبقى الاثنين اندكس وتحطه بالظبط عشان تحس بالظبط اذا كان في تراكيال ديفيشن.
No, you can do
انما
it
جايز
both
يكون
ways.
لها طريقه ثانيه.
Yes, you can do it both ways. I actually prefer single-handed tracheal deviation. لأن you can do the tracheal deviation test just by single hand. You put index and you put middle finger around the trachea. By this you will know. You don't need the other hand to do that. But both techniques are right. If you do it comfortable, if you do it with single hand or double hand, you pass. لأن احنا في ماركينج شيت، كل حاجه بتعملها هتلاقي الاكزامينر معاه شيت كبير كده ومعاه قلم وعمال بيعلم. If you do tracheal shift test you take 1 degree. You do it one hand 1 degree. You do it two hand 2 degree 1 degree. لكن if you don't do it you take 0. So the main thing is you do it. Any other comment?
لا الحقيقه بنشكر حضرتك على طبعا الوجبه الجميله دي يعني.
العفو. Any comment بروفيسور صفوت عبد الغفار ورئيس الوحده؟
الله يخليك، بشكر حضرتك على المحاضرة الجميلة دي. بس كنت حابب ان الفيديو ده كان يبقى فيه بيشنت فعلا عنده سيروتوكسيكوزس، عيان عنده ثيرويد، يعني ده نورمال بيرسون
قوي، ده صحيح. هو
بس كانت هتبقى يعني الافادة اكتر شوية.
اكيد. هو انا بعلم هنا الواحد التكنيك. My aim is to know the 7 steps and you do it many times, so you do it at anything. عشان كده حتى في التريننج للكانديد MRCS بيعملوا examination للثيرويد لبعض. واحد يقول له اعتبرني انا البيشنت how you do examining thyroid ويشوف حافظ الستبس ولا لا. هتلاقي كتير وانا شفتهم from a lot of Egyptian candidates they don't know where to stand when examining thyroid, front or back or right or left. I know when you see enlarged thyroid gland this is goiter, but this is what I'm looking for. I'm looking for your system to examine thyroid to get me all the positive and negative findings, and this is totally different. طبعا بتبقى اظرف ان في ثيرويد، بس في نقطه لما بيجيبوا عيان عنده ثيرويد جلاند انلارجد بيتعب العيان مننا، فما بنجيبش عيان كتير. يعني الاي ساين انا ما انساش واحد كان عنده اكسوبسالموس وبعد تاني عيان هي تايرد، تعب، عينه تعبت. المهم انا كاكزامينر not let the patient to be harmed، وبالتالي انا بقيت العيان هو بيعمل، الدكتور هو بيعمل اي ساين اقول له ستوب tell me what you want to do من غير ما اتعب العيان فيها. ف you can have a lot of يعني thyroid patient to see them، لكن this is not the aim of the exercise. The aim of the exercise to know the 7 steps that you need to do for examine thyroid gland and how to present your finding وانت بتعملها and to become routine بالنسبه لك. والثيرويد من الحاجات المهمه قوي سواء في الدكتوراه او في MRCS.
طيب برضو ما اعرفش هل انا ما خدتش بالي ولا لا، هو البلس.
ايوه
يعني هو ما اعتقد على البلس، مع ان دي من الحاجات الفيري امبورتنت في
لا هو عمل اكزامينيشن للبلس.
عمل اكزامينشن ما خدتش
عمل اكزامينيشن للبلس. انا هحاول اشوف الفيديو بتاعها but he examined his pulse وهتلاقيها موجوده في الفيديو اهو. I think this one let us see sip of water. لا examination pulse مهم. sip of water.
Fantastic, Simon. If you could just stick your tongue out now.
مهم قوي حفظ الروتين والبلس انا كاتبه في ال7 ستيبس.
بالظبط كده، فانا بس ما شفتوش عمل بلس اكزامينيشن.
لا موجود. هحاول اطلعها. دي نقطة مهمة جدا. feeling of pulse.
I'd just like to look at your shins, if you wouldn't mind rolling your trousers up for me. Sure.
انا مش قادر اجيب اللحظه المعينه اللي كان فيها البلس، لكن هو الفيديو هيبقى ريكوردد and you will see that he examined the pulse. والبلس انا كاتبه في ال7 steps. if we go back
Yes.
if we go back 44 TH وقلنا وايبر ايبا ايبا ووتر اي بوكسز، وقلنا هنا ال7 steps اللي لازم يعملهم. بعد الجنرال بيروح للهاندز، والهاندز راديال بالس موجوده اهي من الاربع حاجات دكتور صفوت، دي مهمه قوي. نمبر 3 ان لازم النيل بيد، وهو عمل اكزامينيشن للنيل وخلاه يقلب ايديه، بالمر ايديسيما، فاين تريمور، وراديال بالس. ودي الاي ساين يعمل اربع حاجات، وهكذا لازم يكونوا محفوظين بنفس السيستم ده. وادي النك والفيس بيعمل فيهم ايه، وقلنا ان هون يتعمل من قدام وان هون يتعمل من ورا، لكن دي طبعا نقطه وجيهه. والفيديو هتلاقي فيه البلس، لما احطه على اليوتيوب هتشوفه، هتلاقي فيه اكزامينيشن اوف ذا بلس.
متشكرين دكتور محمد، ربنا يبارك لك يا فندم.
العفو العفو. يا رب يكون بفايده، وان شاء الله ننقي توك تاني حسب توجيهات الدكتور صفوت للجمعه القادمه ان شاء الله، ونراكم على خير وبالتوفيق في جميع امتحاناتكم باذن الله رب العالمين.
شكرا يا باشا.
شكرا يا باشا. الله يخليك.
شكرا جزيلا.
العفو. مع سلامه الله. مع الف سلامه.